Now we're going to shift gears to another agreement by all of the member states, and that happened in New York at the UN General Assembly just a couple of weeks ago, and that was where they adopted the new global goals for sustainable development. This builds off of the progress that was made over the past 15 years with the Millennium Development Goals. These are called the Sustainable Development Goals, or the SDGs, and there's 17 of them, and many of them have a health component to it. But one of them is completely focused on health, and that's goal number 3, to ensure healthy lives and to promote well-being at all ages. To talk about this goal and this work and how we get there, we have 2 people joining us. Dr. Amir Takian, the Deputy Acting Minister for International Affairs at the Ministry of Health and Medical Education in Iran. Thank you for coming by. And Dr. Sameen Siddiqi, the Director of Health System Development for WHO's Eastern Mediterranean region. I want to start us a little bit, I guess, by exploring the concept of universal health coverage, which is really what we're talking about with goal number 3 there. Dr. Siddiqi, let me start with you. Sustainable Development Goal number 3.
That's correct.
To ensure healthy lives, promote well-being for all ages. How do we do that?
Well, absolutely. I mean, you have already talked about it, and I think it's a very ambitious set of goals. If you talk in the context of the health particular goal, it has 9 targets, but let me focus on the specific question that you're talking about, and that is about universal coverage. And indeed, it is a very powerful concept, a global concept, but I'd like to highlight 3 dimensions or 3 aspects of that particular goal. And the first one is we cover for all, the entire population, and that's, I think, a critical element. And we cover with needed services. Those services need to be of acceptable quality, but perhaps the very important aspect of this is that then people should also have financial risk protection. And allow me to just quickly elaborate what that means. And what that means is that when people fall sick, they should not be paying out of their pocket. That puts a burden on them to the extent, in some cases, especially in poor countries and low and middle income countries, that they actually become poor. And health systems should actually protect people from becoming poor rather than pushing them into becoming poor. And those kinds of systems are fair and equitable systems.
So we just got a question in from Twitter, so if I may ask you, how can citizens from within and outside the region help countries reach universal health coverage?
Well, citizens clearly can contribute a lot because they come from the demand side. I think the most important thing, if you're talking of the countries that we work with in this region, are that we see health is a human right, and I think that should be recognized at that, and I think populations should be demanding healthcare, which perhaps is not necessarily the case. But as much as citizens should demand care, I think it is equally the responsibility of governments to ensure that people receive care, And so it's a two-way thing whereby people should be aware of their rights, but government should also be delivering in terms of, making sure that essential services are actually available to the populations.
Dr. Takian, let me come to you for just a second. Let's look at a case study, basically. Iran is a success story when it comes to universal health coverage by everybody that I've talked to anyway. Tell us about the system that you have in place.
Thank you for having me. In Iran, we have had a very comprehensive primary healthcare system since 1984, and this has contributed to great achievements in public health. But there are 2 challenges. The first one was the system was very comprehensive in rural areas, but it was fragile in the cities. And then gradually we realized that we do have out-of-pocket payment, which was really high, almost 56%. So we understood universal health coverage as a good solution in order to address all things which were missing in our health system, which was towards the equitable health system on the basis of the constitution. So Iran has a very comprehensive system in terms of, we do have a number of 60 plus universities across the country. Those universities are very successful in terms of provision of the workforce, in terms of providing the good quality of services and research and treatment and services to the people. And because Iran has a unique system of governance of health system, which is since 1987 we have integrated medical education into the health service. So that's why our ministry is the Ministry of Health and Medical Education. And all medical universities across the country are governed by this ministry, which is responsible for health, service, research, governance, and everything. And this has provided a great opportunity for us in order to address the challenges of the health system. And ever since universal health coverage was promoted by WHO, we took it very seriously, and we did a number of steps with the great help of WHO in order to reach universal health coverage by 2016. And I'm glad glad to share the story, how we started and how we are moving, if you want me to.
Yes, actually, I was gonna go for that. What triggered the movement this way, and what kind of impact have you seen from it already?
Okay. Ever since that President Rouhani came to power in August 2013, he declared health as his first priority. And it is the first time in the history of our country that we have health really as a priority. And that's why our Supreme Leader has announced mega policies for health. There are 14 pillars of the health system on the basis of universal health coverage. President Rouhani built upon this very strong political willingness and the request of people in order to declare health, and then he started a health transformation plan. Health transformation plan came to existence on 5th of May 2014, and with that we wanted to first of all have a better equitable health system, and the second thing was we wanted to increase the quality of the services. And that's why, for instance, we did have out-of-pocket payment which was 56% before health transformation plan. We did have something like 13% of the population, 17% of the population, which is almost 80 million, uninsured or not having effective insurance. So we identified the components of universal health coverage, for instance, extra insurance coverage and covering everybody, increasing the quality of care and reaching out everybody, and no financial hardship for everybody as a principle. And we asked WHO for assistance, for technical assistance. So we were quite fortunate that WHO, the regional office and the headquarters provided us with good advice. And then we had a roadmap. And the roadmap was, we wanted to reach out, first of all, we wanted to reach out the poor, and we wanted to increase out-of-pocket payment first in order to prevent catastrophic health expenditure, which is going quite well. I can say that these had different packages, treatment packages, public health packages. So for instance, in the first year, we pumped $3 billion US dollar extra money into the health system. The money comes from the targeted subsidies and increased VAT, and this goes just to the health system. And with that, we could address now, after almost 18 months into the implementation, we have insured extra 10 million people across the country. I can claim that there is nobody who is uninsured in the country. We have reduced the out-of-pocket payment quite tremendously, at least 10% less compared to the previous year. And now the co-payment, which was one of the reasons for out-of-pocket payment, is maximum 6% in the hospitals, in the public hospitals. For the people who come from deprived areas and the rural citizens, it's just 3%, which is almost nothing. So, and I can say that we have recruited more, thousands of more doctors across the country. Nowadays, for instance, cesarean section, high rate of cesarean section was an issue for us. Now we have reduced the rate of cesarean section almost 7% after 18 months into the implementation. Out of pocket is coming down, and the quality of service is going up. One of the things which we have taken very seriously is monitoring the implementation of UHC. Our plan is to reach universal health coverage by its own means by the end of 2016. And now we are on track. We have started a comprehensive monitoring of the system. We look at the different things, for instance, out-of-pocket payment, patient satisfaction, citizen satisfaction, the reference group opinions about that, providers payment, and so. And since, say, almost a year ago, we have started revising our medical tariff system as well in order to provide a better incentives for the providers. So these all going well, and recently, in the presence of Madam Director General Dr. Chan, we had the opportunity to launch the first series of the results of the health transformation plan evaluation, which was done independently with the leadership of the WHO, and then on the basis of the plan, on the basis of the evaluation, I'm pleased to say that we are on the right track to reach universal coverage.
I know that he has just served to whet your appetite for a longer discussion about that particular situation. He certainly has with me as well, and I'd love to pepper him with questions for another 20 minutes, but we can't. I have a quick question for you before I let you go.
I think a point that I'd like to particularly emphasize, because I've been involved very closely with their review process, you see countries struggle to mobilize resources for health. Now, in the case of Iran, this is a country that has mobilized $3 billion over and above their regular budget. Now, that's something which is not normally seen, actually. So the challenge for many countries is to mobilize. For Iran, the challenge is not the money. The money is there. The challenge for them is how best to use the money to be able to reach the populations, to be able to achieve universal coverage. So that's a big achievement that they, in itself, the fact that they have been able to mobilize such a huge amount of resources for health.
All right, we could continue this discussion, but I will let both of you go.
Okay.
Thank you both for coming by, because you've given us a great example of what we're talking about with universal health coverage. Probably the clearest example I've ever heard with both of you.